Time now for Better Health. I'm joined here with Asante's health expert, Beth Coker and Chris Brokel. We're talking about Coumadin.
And Chris, we hear patients talk about taking Coumadin and having to have their Coumadin levels checked. How does Coumadin work and when is it prescribed?
Well, Coumadin, or what we usually prescribe is Warfarin. And Coumadin is your brand name. Warfarin is the generic, and they don't even manufacture the Coumadin anymore. They stopped that this year. So we prescribe it for basically the prevention formulation of clots or the prevention of extending an existing clot if you have it. Vitamin K is part of the system your body uses to produce a clot, and that's what the warfarin works against. So it's kind of decreasing the effects of the vitamin K. So for our vulnerable patients for stroke or clot, that decreases their risk of that.
And why do patients taking Coumadin have to come in for level checks so often?
Well, Coumadin is a nice drug as long as you monitor it like we do in the Coumadin clinic, and it's very effective. But it's also an older drug, and it doesn't like to play very well with other drugs or your diet. There's a lot of things that interact with warfarin that change your level. The warfarin has to be at a real narrow therapeutic level is what we consider. And there's lots of things that can interrupt that. So the main reason we have them come back is just to verify they're in their therapeutic range. And if not, why not? And try to correct that. I mean, the biggest things that are that interact with it are diet. The dark leafy greens is your vitamin K. So the more vitamin K you eat, the more warfarin you're usually going to have to take. Less vitamin K, the less warfarin that you're going to have to take. So that is one of the biggest interactors.
Are there risks involved in taking the warfarin?
The biggest risk involved in taking warfarin is bleeding. And that's what, your blood gets a little thinner. And but I also consider it a risk of clotting if we don't get you in and get you monitored like we should. And that is kind of like what we're trying to prevent in the first place, prevention of clot or stroke.
Thank you. So warfarin is an important drug to stave off those blood clots. Thank you so much.
You're welcome.
Thank you. We'll be right back.